Today, we'll have a brief review of what is upper gastrointestinal endoscopy. An upper GI endoscopy or a esophagogastroduodenoscopy is a procedure to diagnose and treat problems in upper GI tract. The upper GI tract includes the food pipe or esophagus, stomach, and the first and second parts of the duodenum or the small intestine. What are the indications of an upper GI endoscopy? Commonest are chronic heartburn, dyspepsia or a bloating of the abdomen, abdominal pain, weight loss of appetite, anemia, dysphagia or a difficulty in swallowing, jaundice, gastrointestinal bleeding, persistent vomiting, chronic diarrhea, and foreign body. The common endoscopic findings in the esophagus are a lax lower esophageal sphincter, hiatus hernia, esophagitis, Barrett's esophagus, achalasia cardia, ulcers or esophageal cancers. In the stomach, we can find gastritis, gastric ulcers, polyps, cancers, and Helicobacter pylori infection. In duodenum, we can find peptic ulcer disease, the most common site being the first part of the duodenum and lymphangiectasias. How do you prepare the patient for endoscopy? Keep the patient nil per oral for 8 hours. Obtain an informed consent prior to the procedure. Antiplatelets, if any, should be stopped 24 hours prior to the procedure based on doctor's advice. No diabetic medications on the day of the procedure. And collect history from the patient regarding any heart or lung issues or even allergic reactions. The pre-test evaluation includes vitals screening to be done prior to the procedure. If any dentures are present, they must be removed. Prior to the test, use a local anesthetic spray so that the endoscope does not interfere with your breathing during the procedure. Mouth guard must be inserted before starting the test. The upper GI endoscopy usually takes 10 to 15 minutes. Biopsy will be taken if needed. The vital signs will be monitored continuously. Following the procedure, the patient is advised to stay in the hospital for around 30 minutes. Throat numbness may be felt for around 30 minutes, and the patient is advised to take a normal diet once swallowing returns to normal. Complications, though rare, are bleeding and perforation. Patient may have bleeding while excessive retching or use of any anticoagulants, and perforation may occur during therapeutic procedures.